I ran around and figured 4 years of college, 4 years of medical school, 5 years of surgical residency, and 2 years in a year of a trauma critical care fellowship. He decided to be a physician assistant. That's 3 years, which he went to an accelerated course. He did it in 2 years, and he cut out the rest of the medical school, 5 years of a residency, and 1 year of a fellowship. So he saved about 7 or 8 years of his life. And he works, and he also looked for lifestyle, and that's important. When I started out, we worked 7 days a week. I went in every day for about 15 years. I was in the hospital every single day. I can tell you, unless I was on vacation, and only then I took 1 or 2. Now I finally developed a team, and what I do is a team sport, because we have somebody in the hospital 24 hours around, so we get your weekends and your holidays off. But if you're a PA, most of them are working 12-hour shifts. So you go in at 7 in the morning, get off at 7 at night, you work your 12 hours, you do it 3 days, and you got 4 days off. And that's pretty good. Their salaries go anywhere, if you want to know numbers, their salaries go anywhere from the $80,000, $90,000 up to about $125,000 a year, which is probably around the top 10% of earning income in Yale at this point. And it's a very rewarding, fulfilling job. As a matter of fact, a friend of mine's out in Colorado. I'm on the Bergen County SWAT team. We have a tactical medical response team that responds with them. And the head of that brought me in, Paul Potenzio, when we made the film with Mr. Yeager, retired out there. So here is, he was the head of the Bergen County SWAT team, and he was a lieutenant, and he picked up and moved to Grand Junction, Colorado. So I was talking to him. I ski with him every year. So I was talking to him. I said, how's it going out there? I said, how's your medical care? He says, great. He says, I never see a doctor. I only see a PA. He says, it's fantastic. They're more attentive. They listen to what I say. They're more thorough in their examinations. I feel very comfortable with them. So physician assistant for him is his doctor, unless you're critically life-threatening ill, and then then he'll get the doctor out. So the PAs out in Colorado basically do it all. The paramedics also is a great profession. If you go out to something like Washington State, somewhere there, they even put chest tubes in. They can do a tracheotomy on you in the field. That takes 2 years, I think, 2 years of a associate degree, I'm pretty sure. You have to look this up, and then you go into your training. You get to be an EMT, and then an intermediate EMT, then you become a paramedic. And it takes a lot of hours, takes a few years. So those are professions also. So don't cancel. If you like medicine, there are a lot of other things besides being a doctor. There are lab technicians, there are x-ray technicians. In x-ray, you have ultrasound, you have nuclear medicine, CAT scan tech, MRI, and they take 2 years of an associate degree also, and then you go into your degree to become a radiology tech. So there are a lot of other professions that you can go into in the medical field besides being a doctor. And if you want to be a doctor, that's fantastic. Now, how do you do that? We started talking about it a couple of times. Basically, you have to get focused at this time of your life now. You have to choose your college well, and more than that, you have to do very well in it. It was a little bit harder when I applied to medical school to get in than it is now. And I have some stats. I think there are about 52,000 people trying to get into medical school in 2015, and 20,000 were matriculated into school. So that's not too bad, actually. 1 in about 2.5 to 3. When I applied, it was about 1 in 6 got in. Now, if you look to be a physician assistant, and you go to Boston University, I think they had 900 applicants. They interviewed 100, and they took 36. And that's what a lot of the stats are for some of these. So if you're going to do something like this, you have to get focused at this time. So you have to make sure you know what you're going to do and go and do it. The things that they're looking for is, they're looking for a reason. When you get an interview, they're looking for a reason that you go into it. So most of us go into this because there is a reason that you go into it. They looked at you, didn't suddenly decide your senior year of college, I want to be a doctor, took the MCATs, passed it, went in. They're looking that you dedicated some time to it. So what I would suggest, if anybody wants to do that, is to go and get your EMT, emergency medical technician. I don't know what age you're allowed to do that at.
16.
I should know, I'm the head of the training center in Paramus.
Are there any EMTs here?
Yeah.
Well, I'm training right now.
You're training right now. It's
Mr. Wilson.
180 hours, right? Is it 180 hours? How many hours?
Well, I'm in the school right now.
How many hours is it? Do you know about the course? it used to be 110, and we did better,
Like
maybe test that.
240?
The new one. It's a lot of hours, about 100, it's quite a, you're dedicated, I mean, it takes you a week, it's weekends, right?
It's Mondays and Wednesdays,
Okay,
6 to 10, and then weekends occasionally,
yeah.
7 to 4.
So in addition to your school now, you go Mondays and Wednesdays, 6 to 10.
Yeah, and sometimes Saturdays and Sundays.
Wow,
It's
that's a lot of time and effort and dedication. That's what they're looking for. That's it, right there. So when you go into your interview, that's what you're gonna tell them. You're gonna, because they're gonna wanna know why you did this, you have the reason, and then you're gonna go and tell them, okay, and I got my EMT, they're gonna see it on your CV, because you're gonna have to get in your your CV to them, and you can say, yeah, I did that. As a matter of fact, I was in the honors course at, in Parkridge High School. I went Mondays and Wednesday nights, 6 to 10, and I still got great grades, and I did this, and I'm very focused, I can handle this kind of work, I've done it before. So, they wanna see that you put in hours and hours in this. Now, if you wanna be a PA, let's say, they're looking for 1,000 to 4,000 hours of medical dedication somehow. In other words, an EMT, which you get a lot of hours doing that, and then you go out and you actually work out. So looking that you actually did stuff. They're looking to make sure that you are dedicated into this, because there's so many people applying for it, they wanna make sure that you're gonna be there. So your grades have to be good, your dedication has to be good, your extracurricular activity has to be there, okay? Your MCATs have to, when you take that exam, and I'll give you some of the information I got. 10 tips to get into medical school. They want medical experience. They want research projects. Now, how do you do the research projects? Let's say you wanna get into that. Okay, when you're in college, there are certain things that will be open to you that you can do. At Hackensack University Medical Center, they have a research program in the summers, mostly for college kids. So in other words, if you come in to your summer break and you're not working, or even if you are working, they can tailor the hours. You'll go and you'll go into the volunteer office, contact the emergency room office also. You can call the hospital about this. And then when you sign up for this, they'll get you into one of the research programs. You may be a data collector, you may be just taking information from patients, so focusing on patients that want to go into the type of research project. You may be looking for charts, but they're looking for that. So there is something available at Hackensack with that. While I'm on that subject, there's also a careers in medicine program at Hackensack. Now, I've had a lot of college students follow me around. What they'll do is you'll sign up for this program, and they'll assign you to whatever area you want to go to. So I'm in trauma critical care. So somebody will follow me around, or follow my paramedic, my PAs around, or my residents around. They'll do ICU rounds and critical care rounds with us. They'll do trauma rounds with us. They'll go to our trauma activations. But you have to be in college to do that. So that program's available. Since you're all in Bergen County, you're all probably going to come back to us this way. Those two programs are available at Hackensack. They want to see that you did community service. My son worked at Camp Sunshine. Anybody familiar with Camp Sunshine in Ridgewood? Yeah, he worked there. And Rachel also worked there. She was actually the manager of that for a while. So they're looking for some type of community service. Want you to, if possible, to speak a couple languages. It's also good to be a minority or female to get into medical school, because the percentages are higher to get in. So take whatever you can get, right? If you got something, you use it, right? But a minority and also a female, they're accepting because they want to balance everything out and keep everything. They want us, when you go to college, choose a major that you can excel in. Now, one of the ones I really like is chemistry. Now, I don't go into chemistry just because I said that, but they really seem to like chemistry. It gets you a little bit smarter if you're a chemist or something. I don't know, I kind of blew myself up in chem lab in college and it started a fire, but they had to turn the shower on. But they like chemistry, but choose something that you like, because you have to excel in it. Don't choose something like physics or whatever that you're just hanging on, by your nails, and you're not going to get good grades. So whatever that is, make sure. They also want to show that you have a life too. And I went on the internet to see what they're looking for today. They want to know that you have a life. So I guess they wanna know that you do other things, you know, you hike, you camp, you do, you know, travel, you do something, that you're just not sitting in a book. I can tell you that I have medical students now that, some of them I don't know how they got into medical school. They're very smart, but there's no warmth, there's no touchy-feely, there's no compassion, there's some of them, you know, not all of us are like this, you know, have that. That's a good quality. You can't develop, it's just what you are. But they're looking for people that can relate, you know, they just don't wanna see somebody that's the biggest brain in the world. So you have to be able, when you go into your interview for something like that, you have to give and take. You can't be rigid. You may wanna practice. They actually have people that practice on the internet. You know, that you can find them on the internet, they can actually practice interviews with you. And they'll go through this with you and they'll interview you so that you become good at it. Because it's very important that you do well if you get an interview. In any of these, either, you know, a PA, a nurse practitioner, or whatever, it's very important that you interview well. Because that's where, you know, like I said, at BU for a PA, they had 900 applications, they interviewed about 100, that's 1 in 9. And now they gotta bring it down. That means you cut the mustard with your grades and your CV, cut it. So what's it up to now? It's up to how I talk to you, how you talk to me, and what you're about. And they try to get into you and see, you know, what makes you stir. So you may wanna think of that as to go somewhere and practice, you know, being interviewed. Just like it's happening with the election now, Hillary Clinton and Trump, they go and they have practices. So, you know, they do that, and I'm not saying anything about that, I'll just leave it right there, but they practice, because, you know, it's how they come across. Any questions so far? Comments? Yeah.
While you were studying to become, you know, a trauma surgeon, was there any feeling like I could be doing something else, like maybe more fun?
Oh yeah. The bathroom, yeah, every time somebody called me up and said, we're going out, you wanna come? Yeah, no, I tell you the truth, I kinda love what I did. It's very interesting, it's great, so I got absorbed in it. It just swallows you up, and that's what I said, that first comment, is basically, the bad comment was you lose your life. I turned around and I got much older, and a lot of years passed by. And a testimony to that actually was Frank, my son, that decided he was gonna be a PA and not do what I did, and I think he's smart enough to get into medical school, because he saw what it did to our lives. Although I was always home, never went out, you know, when I was home with them, or I was working, but I'd be running out at 2, 3 o'clock in the morning all the time. I'd be tired on Saturday, so it does swallow you up. It depends which subspecialty you go into and how you practice it, whether you go into a group practice or single practice. When you guys get out of medical school or wherever you're going, it's gonna be group practices. If you're working as a PA or whatever else, or a X-ray tech, or that, those are set hours. I mean, you're gonna have set hours. And most everybody's gonna probably be working for hospitals or big healthcare groups by then. So the way it looks like the medicine's going, so you won't have those problems. Your life will be much better, your quality, and that's one thing, your, in quotes, quality of life will be much better, and that's what you're interested in. So it's set up much better for you than it was for me. But you don't see time pass. Yes, Mr. Yeager, do you see time pass?
Sometimes.
You get swallowed up by what you do, right? This is what you do, and you're good at it. That's the reason why you are. Any other questions? Comments?
Dr. Leffer, I have
Yeah.
kind of a simple question, which I've always wondered about. What is the difference between a trauma unit and a regular emergency room?
Okay. A trauma, you're able to handle any emergency 24 hours a day. The resources that I just told you, I mean, when I made all the trauma codes, and there are 3 different levels of trauma codes. I told you about the highest level of trauma code. Let's say there's a bad crash here, and we've gotten some from Park Ridge with people hit by cars and stuff. By the time you get to the hospital, all that's assembled, ready to go. There aren't many hospitals that can produce the resources to do that, or want to spend the money to do that. It's very difficult. As a matter of fact, when I went to make Hackensack Trauma Center years ago, it was in 1988 or so, nobody wanted it there, because all they were thinking of is shooting, stabbings, and this, that, and the other thing, and they lose money. So I talked to the Board of Governors, I gave them a presentation. What I did was, I took all the, I went to the more sensory stuff. I took the Bergen Evening Record, I knew I was gonna give this talk, so for about 3 months before I gave it, I was taking articles out, crash here, this one stabbed, this one did this one there. I took a picture of Yankee Stadium, I took a picture of the, I had pictures of the airport, of a football game, and I said, things like, how long before a bomb goes off here? How long before this is your daughter that's in this car accident on Route 4? How long before there? And they decided to dump the resources into it. But it's a tremendous amount of resources and timing. I mean, I've had people in the operating room operating within stabbed in the heart within 5 minutes, opening their chest in an operating room. I've given as many as 40, 50 units of blood. We have a rapid transfusion, massive transfusion protocol. You know what a unit of blood is, 250 cc's, it's a pack, you always see it on television. If I activate a massive transfusion protocol, we call it MTP, activate the MTP, what happens is, every 20 minutes, 4 units of blood, 4 units of fresh frozen plasma, which is the coagulating factors in blood, and 6 units of platelets come to the operating room every 20 minutes until you tell them to stop. The amount of stress and strain that puts on a blood bank, just to be able to get that amount of blood there. We keep 2 units of fresh frozen plasma, which is a reversal for Coumadin, which is a blood thinner. We keep that thawed, ready to go. Because we get so many older people now on anticoagulants that come in with Coumadin on and hit their heads and bleed, we can't wait the 45 minutes or 35 minutes for it to defrost, so, from the thawed. So we just have it and it's picked up immediately. But there are a lot of protocols and a lot of things that go into what we do. I have to have, in a trauma setting, your neurosurgeons, the most critical people, your neurosurgeons, your orthopedic surgeons, and your vascular surgeons, your thoracic surgeons have to be available within 30 minutes of being called. Within 30 minutes, that's pretty hard to get in a community hospital, to get a doctor to come in within 30 minutes of an emergency or a subspecialist like that. So, it's quite, so my day goes like this. We go in, let's say, we divided it up now into 3 groups, so we do. I'm a trauma surgeon, so, right? So what I do is I go in, if I'm on trauma call, I'll go in at 5 o'clock, which I'm going in tonight, I'm on at 5 o'clock tonight, I'll get out at 11 o'clock tomorrow morning. Any trauma that comes in during the night, I handle. At 5 o'clock tonight, I'll go up to the surgical critical care unit. The trauma surgeon that's doing the critical care unit for the week will turn over the 14 critical patients in there to me. The trauma surgeon that was on during the day, he'll come up and he'll turn over any critical stuff that's going on the floors. We tend to carry around 30 patients on the floors. So we have an intermediate critical care unit too, and that's where most of our trauma patients are. So he'll turn those over to me. Those 2 will go home, then I'll be on call all night. I have a PA, a physician assistant in the ICU. I have a physician assistant on the trauma floor, the intermediate care floor, and I have 2 surgical residents that are on call with me. Something bad happens, I have to go to an operating room. I start going, I yell for the second call. The guy that's the trauma surgeon that's in the critical care unit all day, he's on second call, so it's 3 o'clock in the morning, he's gotta get up, and he's gotta come into the hospital. It's 3 o'clock in the morning, he's the second call, so he comes in. And then he may be in for 3 hours at 6 o'clock in the morning, he may go home for an hour and he has to be back in to make rounds at 9 o'clock in the morning, or 8 o'clock in the morning. So it's pretty rigorous. We do that for 7 days straight. Not the night guy, just the guy that's on the floor and the guy that's in the critical care unit takes it for 7 days straight. That gives you continuity of care, the same guy taking care of everything, and then he turns over on that next Monday. Every morning we meet at 8 o'clock in the morning with the surgical residents, the PAs, the critical care attending that comes in, the intermediate, the trauma surgeon that's on that day, and the trauma surgeon who's on that night. We go into a room, we have a projector, we turn over every case that comes in. The films, let's say if there's an interesting case of, bleeding a spleen, we'll put them up on the computer. We all look at it, we talk about that. We'll teach the residents then, the residents are there with us. We'll start asking them questions about how do you manage this, what's the percentage of spleens, what's a grade 2 splenic rupture, what's a grade 4, what happens if your spleen's out, what 3 shots do you need, and that's how we train people, because that's on the job training kind of for them. And that's the clinical things that they've learned it in books, but it's hard to remember a lot of stuff. But when you see a spleen with a big bleed in it up on a screen, And you say that, okay, this spleen here, what was his blood pressure, 90, okay, we were able to maintain him, we called the angiographer in, they came in, they embolized the spleen. And then it bled 5 hours later and they had to take it out, now you need 3 shots, you need, pneumococcus, pneumonia, meningococcus, and influenza shot to get, before you leave the hospital. So we'll talk about all that. So that's the way the day goes. And that goes day after day, night after night, and that's what we do. So, it's kind of fun, actually. It's a lot of fun. We get things like, I don't know what kind of, the plane crash, I don't remember if you remember, there's a plane crash at Teterboro, there was a plane that went right off into a factory there. You don't remember things, there was a NAP chemical blew up, we do burns also. So we do just about everything.
I would imagine a high percentage of car crashes.
Yeah, no, actually, yes. What we're getting is a really high percentage of people getting hit by cars and older people going downstairs and falling. It's an epidemic now because the baby boomers, my generation, are getting older, and they're terrible. Oh God, we are just going to be a mess. It's a mess. We're a hot mess out there, and they're all on anticoagulants. And a lot of them you've probably seen. You see it on television when you see the advertisement for anticoagulants. Some of them you can't, they say, well, if you get a bleed, you could die. Yeah, you know why? Because you can't reverse it. Some of them making now, you can't reverse them. So once you get them and your blood's thin, you can't clot, you can't reverse that. So you come in, you just bleed. There are a couple that you can reverse, but there are many that you can't, and they're trying to make them now, they're starting to come out now that you can reverse.
Pop quiz, does anybody know why so many elderly are on anticoagulants? Do you know what anticoagulants are?
The blood thinner.
Why would so many elderly be on them?
Yeah, good. Strokes, blood clots, you had a stent in your heart, they go on Plavix and aspirin, depending what you had, yeah, that's definitely it.
But from a public health perspective, you can see how when we try to treat one thing, it could have unfortunate side effects in other areas. So an elderly patient falls down the stairs and they're bleeding. As you're hearing, it's very difficult to get that blood to stop bleeding, to clot.
Your body's tooled to be about 115 to 125 years of life. If you're born today, about 1 in 3 of you, 1 in 3 will live to 100 years old. But there are a lot of problems coming with that. Darwin's natural selection is out the door now because we changed it all. People that should die, there are young people that these equipment aren't great, and we kind of start getting medications when they're younger. They don't really reproduce at that age that it makes that much of a difference probably, but we do keep everybody alive now. And now with that, we get all these other problems are coming in. And now we're trying to treat those, so if they ever get a cure for cancer or whatever else, this is the selection part. This is where nature is. My dog is sick right now, and he's seizing, he's probably got a brain tumor. He's probably not gonna be around too much more. But, we try, it's amazing to me, how many people on the earth, how many billions?
7 billion.
Okay, a little faster when I ask you next time, okay? That was pretty quick. 7 billion people on the earth, right? One person out there tries to die, we throw everything at him, everything. Paramedics come, the helicopter comes, he goes to the hospital, I got 17 people in the trauma room, we run them to an operating room, we do everything. One person tries to die, we jump on top of that, right? And there's 7 billion. There are a lot of countries where they're quite as lucky as we are. They can't do things like that, but where we are, we stand a good chance. But it's always remarkable to me that we're like ants crawling across the earth here, but if one of us runs into trouble, everybody chips in to try to help him and get him out. And that's what you'll do in the medical profession. Any other questions?
Have you done work outside of this country, like a Doctor Without Borders?
I haven't. I've been thinking of it. I medevaced one of our cops that was shot from Paradise Island. The state police medevaced him down when I got him out of there. I haven't. I've been seriously thinking of going to Haiti. I'm not sure. We'll see what happens. I have a lawyer friend of mine that does a lot of helps out down there, and he gets a private plane to fly him over. So I may go these days.
Dr. Okur is actually being a little modest honest, because he's always involved in prevention programs, education, things like the films that we've done, a lot of things that we've done right here in Park Ridge. So it's, to be in medicine, and then to be in surgery, and then to be in emergency surgery, and then to be in trauma, I mean, you are seeing probably the tip of the iceberg, the top of the triangle in terms of a very busy job, very important job. So, I mean, you're hearing that it can be very consuming, it's a lot of education, it's a lot of hours, there's a lot of sacrifice. What you didn't hear, and I will tell you, is you can't walk down the street or go to Garden State Plaza without somebody coming up to Dr. Licurdo and saying, you saved my life. So you've heard that it's challenging, and you've heard that there's a lot of creativity, but the rewards are significant as well, not just financial, but I mean, you really want to make the world a better place, as most people do. There are very few better ways to do that than to actually be saving lives. He'll probably be saving a life today. It's an extraordinary.
Hopefully not.
Well, yeah. Well, if the need arises, hopefully he'll be saving them today.
Yeah, it's quite a profession. I trained at University Hospital in Newark. My worst weekend in Newark was 21 shootings and stabbings in 48 hours. 21 shootings and stabbings in 48 hours. That was back when it was really bad down there. It's getting a little better.
Was that shooting stabbing like included as in 21, or like 21 shootings and 21
No,
stabbings?
21 shooting stabbings, there were bludgeonings, there were machetings, there were hatchetings, there was
Okay.
stuff like you can't believe. Man, yeah, I was a trauma fellow. It was a hot summer day, a lot of drugs and stuff, and boy, when it gets hot down, in Camden and Newark, and it's just a fact. I mean, nothing bad, it's just a fact. Yeah. The political statement is all these idiots that are running for president right now. Maybe they should focus on inner cities and drugs and stuff like that, and gangs. So that's my political statement for the day. I won't go further than that, because that's where they really need it. They wanna help people, that's where they help people. In the inner cities, there are thousands of people being held hostage by gangs and drugs. Anybody else? No? You look like you're, okay. Okay, so that's it. I don't think I have much more to tell you. If you wanna talk to me, or you need some advice as time goes on, I hopefully will be around for a while. That'll be it, I'm kind of backing out of Hackensack. I'll still take a couple calls, but I am around. Andy knows how to get a hold of me. And don't forget, Hackensack has a couple programs that if you do get involved, the Careers in Medicine program, you have to be in college, and also the research program. Very important for medical school. Those are your best two tips. You get your Careers in Medicine, because at least go out, and then you have to do volunteerism. You have to get out there. EMT is a great way to go. And then you should try to do work with whatever your passion is. If it's cancer or whatever, they probably have volunteers that work at the cancer center. But there are ways to get involved, because they're gonna look at that. Okay?
I will please join me in thanking Dr. Licurdo for taking the time.
I'm gonna be able to be taking care of me, so study hard.